Hello, my name's Adrian and I'm a plastic and cosmetic surgeon, and I'm the medical director of Aurora clinics. And today I'm going to be talking a little bit about lower face Botox, and this is really a continuation of the series videos on Botox treatment. So what do we mean by lower face? Well, it's basically anything below the eyes. So upper face Botox is really frown lines, raising eyebrow lines and crow's feet lines. By lower face Botox we mean from eyes and down. So lower face Botox has really come of age in the last 10 years, and it's a bit more complicated than upper face Botox. And the reason for this is there are many more muscles in the lower face. There are muscles for speaking, smiling, eating. So Botox basically weakens muscles, but we've got to be very careful which muscles we weaken. It isn't so much of a problem in the upper face, but in the lower face it can be a problem. So the potential side effects from Botox are more common, and it's important you're aware of that. Okay, so which areas can we treat? Well, I'm going to work down the face. So the first one is the so-called bunny lines on the nose, and these are the scrunch lines that you get on the nose, which are very prevalent in some people. Some people like them, they're associated with happiness, with smiling. Some people don't like them, and they would like them reduced. And we can do a very small injection in that area into a muscle called the nasalis muscle, just to weaken those areas. So that's relatively safe because there aren't many muscles, really important muscles in that area associated with smiling. Working down the face, we can treat the muscle which turns down the corner of the mouth, which is called the depressor anguli oris. And this is the muscle which just pulls the corner of the mouth down, and by very small injections there we can upturn the corner of the mouth. So any depressions in the corner of the mouth are normally treated with dermal fillers. An alternative is Botox treatment, just to turn the corners of the mouth up, and that's a relatively safe injection. We can also treat a chin. So some people have very dimply chin, so sort of quite a wavy surface to the chin. Again, 2 small injections either side, just weaken the muscle in the chin slightly and make it smoother and more even. The other area we can treat is the cords in the neck, which you get when you're slightly older, and these sort of bands like that in the neck, and we can just soften those with Botox. It's important, it won't tighten the skin, so it's only really used for people with bands, but with relatively tight skin. If you've got very loose skin in the area, Botox isn't really a solution for that. Something people talk about recently is a facelift using Botox, and this is called the what's called the Nefertiti lift. I think Nefertiti was a goddess in Egypt who had a apparently very nice jawline. The Nefertiti lift basically uses small amounts of Botox to weaken the muscle which pulls down on the jowl areas, and by weakening that muscle the jowls will go up slightly and improve the contour of the jawline. The other areas you can treat with lower face Botox around the mouth, these are the so-called smoker's lines, the vertical lines, also known as barcode lines, on the upper lip. Very small amounts of Botox can be given just to soften the upper lip. We've got to be really, really careful with that injection because we don't want to weaken the lip too much. You know, we need the lip for sort of oral seal, eating, blowing, sucking, you know, just normal facial activity. So we've got to be very, very careful with that one. And you should be really used with experienced practitioners. And the last one you can use for is nasal flare, which is when you smile, your nose can sort of widen, and that's caused by a muscle here, and we can selectively weaken that. So essentially, upper face Botox, safe, predictable. Lower face Botox, slightly more risky. You need to really discuss it with your practitioner. You know, ask them how much experience they've had. Are there any alternatives to Botox for these areas? And Botox should be used sparingly, really in the lower face, much smaller doses, and a much more sophisticated treatment. So I hope that's clarified some of the issues you know, regarding lower face Botox. If you have any questions or queries on any of the topics I've discussed, or any of the other subjects and treatments offered by Aurora Clinics, please don't hesitate to contact us either via phone, which is 01844214362, or contact